During surgery and patient recovery, the Thoratec VAD pumps are driven by the dual drive console or the TLC2 portable driver, each capable of univentricular or biventricular support. A single driver can thus support a BiVAD patient. For purposes of this training video, the console calibration and startup procedure for the dual drive console will be described. The console is connected to each VAD pump by a pneumatic lead and an electrical lead, which regulates and monitors the system's operation. Each VAD fills and empties in cycles, driven by air pressure and vacuum from the console. The console operates in one of three modes: asynchronous, volume, and EKG synchronous. The normal mode of console operation is volume, also known as full to empty, where the VAD rate changes automatically based on cardiac preload. During each fill cycle, the drive console creates a vacuum to help fill the blood pump. The regulator control knob below the vacuum gauge can be used to adjust the level of vacuum. When the pump is full, the drive module supplies air pressure during the ejection period to empty the blood sac into the patient's arterial system. The regulator control knob below the pressure gauge can be used to adjust the drive pressure. The console's fill indicator lights green when the VAD is completely full, triggering the beginning of the next ejection cycle. As the preload increases, the VAD will fill faster, decreasing each pump cycle. The pump rate and output will also increase, clearly indicated on the console. An alarm is triggered when the fill signal is lost in the volume mode. This is generally due to inadequate preload. Before the dual drive console is used to drive the pumps during surgery, it must be set up and calibrated. While in storage, the console should always remain connected to an AC power outlet with its main power switch on. Check that the power switch for the uninterruptible power supply, the UPS, which provides battery power to the console, is also on. The status panel on the front of the console should read, "Load, no lights. Battery, 1 to 5 green lights on. Alarm, off. Inverter, on. AC, on." When the console is brought out of storage and ready for use near or within the operating room, open the console's back door and turn the top and bottom module's power switches to the on position. These are toggle switches which must be pulled out and then up. The selector valve should be in the center position. This valve is for short-term emergency use and allows one module to pump both VADs. Next, the pressure transducer of each module should be calibrated for accurate pressure measurement before the console is attached to the VAD pump. Routine calibration during device operation is not required and not recommended. To begin console calibration, move the calibration switch on and verify that the pressure eject fill indicator light flashes. Press clear, then enter on the front panel. The set value and eject fill displays should read 000 plus or minus 1. If not, press 000 on the console keyboard, then press enter. This completes the calibration phase. Turn the calibration switch to off, then verify that the pressure eject fill indicator light has stopped flashing. Now repeat the calibration process for the second drive module. While the VADs are being implanted, the console should be prepared for use. Occluders on the pneumatic ports will allow the operator to preset eject and vacuum levels. Turn on the compressor switches for the top and bottom modules. Verify that each drive module is in async mode. Preset the starting rate at 40 beats per minute with a systolic percentage of 20. Set the vacuum between 0 and -4. Finally, set the eject pressure between 100 and 110 millimeters of mercury. The pump can now be turned off by pressing the Pump On button and then the Enter button. During surgery, the VAD pumps are manually de-aired using hand pump bulbs. Once the VAD pumps have been properly de-aired, the next step is connecting the pneumatic and electrical leads to the appropriate drive module. The electrical leads are supplied sterile. One end will be passed from the surgical field and plugged in to the console at the appropriate fill switch in port. The pneumatic leads are also supplied sterile. Each should be inserted into its corresponding driveline port. When directed by the surgeon, press pump on, then gradually increase the eject pressure until the VAD is ejecting completely. This can be verified by a flash of light resulting from the two sides of the VAD blood sac touching. Once the VAD is filling and emptying at 40 beats per minute in the asynchronous mode, operation can be switched to the volume mode. Vacuum can be adjusted up to -25 millimeters of mercury while the chest is open to assist VAD filling. This concludes the startup procedure for the dual drive console.